I'm joined by Brian Dow, Chief Executive of Mental Health UK. Brian, thanks for joining me. Now, Brian, the pandemic has brought with it a lot of physical and mental health issues, but it's also had a clear effect on people's mental health too. What impact has the pandemic had, and how has it been addressed?
Well, I think from the outset, this has been a mental health pandemic every bit as much as it has been a physical health pandemic. Of course, the risk to life from the virus itself is very profound, but I think we've all become a great deal more literate in understanding that the effects of isolation, of grief, the worry about losing a job and financial difficulties, all impacts on our mental health. And I think both in terms of the governmental response, as well as the community response across the UK and indeed across the world, has put that fact at its core that actually if we're not attending and supporting our own mental health, then our physical health suffers as a result, and vice versa. So I think actually, although the pandemic has been a hugely profound and damaging episode, of course it has, for millions of people, one of the positives that arises from it, I think, is that we all understand how to support our own mental health and the mental health of our friends, our colleagues, and our family.
How have things changed in how mental health has been perceived by the general public, employers, and in the media in recent years?
There's been a huge shift in the way that we think and talk about mental health over the last couple of decades, really. I think firstly, you saw a number of celebrities coming forward in the last 20 years or so, and that's helped build this public mandate. After all, we all have mental health, and we began to see the political parties making commitments in their manifestos, and in turn, happily, that's led to a much greater prioritisation across the National Health Service. And in time, what we're going to see is record levels of funding going in. Now, the reality is that we've still got an awful long way to catch up with physical health. Employers are beginning to understand that if they don't attend to the needs of their employees' mental health as well as the physical health, then that frankly in turn begins to affect their bottom line, because of course mental ill health is a huge cause of absenteeism. And in terms of the research and the understanding of conditions that exists out there, there still is a great distance to go. But we're making progress, and I think the hope is that perhaps in the next 10 or 15 years, we can really begin to talk about parity between mental and physical health.
As you say, just like physical health, everyone has mental health too, even men. Have we now got beyond that stereotype of keeping a stiff upper lip?
I think we're beginning to get there. And certainly campaigns like the Time to Change campaign, which was run over the last 10 years, designed to kind of break down the stigma and misunderstanding around mental health, have helped. They've demonstrated to people that actually 1 in 4 of us have a mental health problem at any given time, and that therefore you will know somebody in your social circle or your family circle who has a mental health problem. And that's encouraged that kind of desire to talk about mental health. But talking about mental health, and certainly talking about mental illness, doesn't solve it. I think we've still got a great distance to go before we have a genuine kind of level of understanding about the complexity of mental illness and how that results in people's lives becoming sometimes incredibly difficult. So I think we're making progress with getting rid of that stiff upper lip, but I don't think it's completely evaporated just yet.
Do we all have the responsibility to look after people who might be suffering from mental health, be that in the workplace or school? How should someone approach doing so?
Well, it's interesting that latterly we've seen sports stars talking about how they need to take care of their mental health and their physical health. And that's been a bit of a shift, to say the least. Over the last couple of years, we've seen really big employers coming forward and talking about how they want to put mental health at the core of their strategy, because they recognise that it's good for their employees, but it's also good for the bottom line. If your employees are not performing because of the mental ill health, then your business is going to struggle. And I think fundamentally the pandemic has made us realise that mental health doesn't just exist on its own. All those other factors, like your financial situation, the security of your job, Is your house, your home safe? And are you feeling isolated from your social circle? All those things matter. So I think that notion of being there to support somebody who's struggling with their mental health, making sure that they are able to talk about it, but actually encouraging people, if they have a problem at work, perhaps to seek assistance through their employee assistance program, or indeed, perhaps if they are struggling in terms of the wider mental health, to develop that relationship with a doctor and to seek that help and not to feel alone. I think that is the responsibility that we all have as friends, as family members, and as colleagues.
Brian Dow, Chief Executive of Mental Health UK, thanks for joining me.